on this Wednesday, November the 19th. With us today to provide a briefing is Dr. Linda Bell. She's the state epidemiologist and the health programs branch director for the Department of Public Health. What we'll do is I will turn it over here shortly to Dr. Bell to provide that update, and then we'll take your questions afterwards. So without further ado, Dr. Bell, I turn it over to you.
Yes, thank you, Ron. Can you hear me okay?
Sure can.
Okay, thank you. And good afternoon, everyone. For our South Carolina Department of Public Health update, I'm reporting that on yesterday we announced 5 new measles cases in the state since last Friday. 2 of the 5 cases are household members of known measles cases who were in quarantine. And as yet, we have been unable to determine the possible source of exposure for the other 3 cases. To date, this brings us to a total number of cases in South Carolina now related to the upstate outbreak to 49. And the total number reported to DPH this year is 52 measles cases. As of yesterday, we had 84 people in quarantine, and the latest end date for those in quarantine is December the 12th. The initial investigation of contacts of the new cases has determined potential exposures in public settings. Additional information will be provided once more details are obtained about these settings. The direct contacts and impacted facilities are being notified of the potential exposures, and we unfortunately expect the number of those in quarantine to climb as a result of these investigations. We anticipate having more information to share about public exposures in our Friday update. The unidentified source of the 3 new cases emphasizes the risk of ongoing community transmission in South Carolina. Furthermore, the upcoming holidays may increase the risk of exposures greatly for those traveling through airports, for large family gatherings, and hosting visitors who could be early in their infectious period. It only takes 1 case to bring measles to an entire family gathering. And in fact, at least 27 of our cases reported so far have occurred as a result of household contacts and transmission in household settings. Therefore, if those currently in quarantine join family gatherings during the Thanksgiving holiday, we're likely to see ongoing spread moving into the Christmas holidays. And the implications of what this could mean in under-vaccinated groups is a significant concern for us. For those in quarantine, currently, DPH strongly encourages those families to strictly observe the quarantine restrictions this Thanksgiving and forego family gatherings beyond their immediate households if they are still in a quarantine period to protect the others. We strongly encourage people to get vaccinated now to prevent measles from disrupting your holiday plans moving into the Christmas holidays and forward. This can help us avoid serious illnesses. It can protect our communities from ongoing spread as well. So far, the community response to DPH's call for increased vaccinations has been a bit promising when we look at vaccinations provided by all providers. Because according to the Simon statewide vaccination reporting system, there has been a 110% increase in MMR vaccinations given by all providers in Spartanburg County for October of 2025 as compared to the month of October, the same month in 2024. I'm also letting folks know that for now, we are going to wind down our deployment of DPH's mobile health units providing MMR vaccines, so that after the events that are scheduled for this week, we'll have one more community event on Monday, November the 24th at Mount Moriah Baptist Church in Spartanburg. Since October 16th, when the first mobile health unit was deployed, DPH staff have administered 42 doses of the MMR vaccine to the public, 32 of those doses to adults and 10 to children. So with that information, I'm going to turn it back to you, Ron, so that you can help us answer any questions. Thank you so much.
Thank you very much, Dr. Bell. And now what we'll do is I'll turn it over to your questions. If you have a question, please raise your virtual hand. I will call on it in the order in which it is raised. I would ask that if you have any follow-ups, wait for others to have their questions answered first, and I'll be happy to come back to you. So, Tom, you're up first. Go ahead with your question.
Thanks, Dr. Bell. So when you say potential public exposures, I know at one point we were differentiating between schools and say businesses like a restaurant or gym or something like that. So can you say if schools are involved at this point, or do you have any way to help us clarify what kind of public settings you're talking about?
So we are talking about schools and potentially other settings, and we will provide more details about what we've learned from those investigations in our update on Friday.
Thank you.
Thank you, Tom. Julia, go ahead with your question.
Hi, I just have a couple clarifying for my notes. I think I got on like a minute after you started speaking. What is the number of cases, the case count right now?
So as of yesterday, our case count was 49 related to the upstate outbreak. The total number reported to DPH so far this year is 52.
Okay. And then someone had also written in the chat how many people were in quarantine, and I am also curious about that right now.
As of yesterday, we have 84 people in quarantine, and the latest end date for those currently in quarantine is December the 12th.
And that's all I have. Thank you.
Thank you for that question, Julia. Anyone else have a question for Dr. Bell? Julia, do you have a follow-up, or is your hand just still raised?
Oh, I'm sorry about that. I didn't mean to keep it raised.
That's quite all right. We all do it. Any other questions for Dr. Bell? And again, we will have more information later on in the week about those public exposures. Seeing no further questions at this time, I would say that if you have any further questions that you think of after this briefing is concluded, that you can send them to media@dph.sc.gov, and we'll do our best to answer your questions there. A copy of this recording will be provided online on our YouTube channel. That's our Department of Public Health Agency channel on YouTube. And again, I'll throw it. I know we had a couple of late additions. I want to ask one more time if there are any questions from folks before I conclude the briefing for today. All right, seeing none, I want to thank Dr. Bell for your time today and everybody else for your time in covering this very important story. We appreciate you.
Sorry, Ron, I think we do have a
question.
question.
I think we do. Tom, go ahead, sir.
Hi. So just to clarify, we saw a big jump in the quarantine numbers from Friday to now. So is that all related to the three new cases where the source has not been identified?
So the total number currently in quarantine is not solely related to the new cases. This includes all who are currently in quarantine. And we will provide additional information about various settings when we have more information from our investigation. So the total number of those in quarantine is not only related to the most recent cases, but obviously responsible for the jump from what we previously reported. Partly responsible for the jump that was previously reported because we've identified new exposures.
Okay, thank you.
Thank you, Tom. Carrie, go ahead with your question.
Hey, this is Carrie Beal with Fox Carolina News. Yesterday, you gave updates on vaccination rates in Spartanburg County. And sorry if this has already been covered, but I was wondering if there's any more updates on vaccination rates in the schools. I know we had that for last year. And last time I asked this question, you said you don't have those at the moment, but I just thought I'd ask to see if that's been updated yet.
No, we don't. We receive vaccination coverage data from the schools annually. So we are not monitoring coverage rates in the schools on an ongoing basis. And so what I reported previously is based on what the schools have reported for those enrolled after 45 days in the school. And that is an annual report. So we won't have further updates on vaccination coverage at the school level.
Thank you for that question, Carrie. Anybody have any further questions? All right. Again, seeing none, I do want to thank everybody for your time today, your time over these past weeks as we've continued to cover this outbreak, and we'll continue to do so. Our next scheduled update will be this Friday at noon. If anything happens in the meantime that necessitates an update, we will provide one at that time. However, that's our routine that we'll stick to for the time being. If you have any questions again in the meantime, the address to send them to is media@dph.sc.gov. And I'll repeat for those who didn't hear before, a copy of this briefing will be posted to our agency YouTube page at the conclusion of this briefing. And if you have any further questions, you can reach me at the address I mentioned before. Thank you again, Dr. Bell, and thank you to all of our media partners for your continued help in covering the measles outbreak. Thank you.
Thank you, everyone.